whenever all of this happened with COVID, I think a lot of it reared its ugly head, the stuff that we've pushed down and ignored. All of a sudden, we were left there with our thoughts. We were stuck in our house, and we had to reevaluate what was important to us and where we were in our life and in our career, and if we were happy.
Yes, exactly.
And, you know, a lot of us realized we were not.
Hi, welcome to the Awakened Hygienist. This is our Think Outside of the Box series, and I'm so excited to have you here listening to this interview with Jennifer Stanley. So today's topic is the shadow side of dentistry. And Jennifer and I have met previously and discussed how we saw this interview process going. And the reason why I came up with the shadow side of dentistry is because when we think about the shadow side is really just neutral, okay? It's our perceptions that cause judgment to be either good or bad. So something I might see as bad, you might actually see as good. So it's really based in our perception, right? Well, the shadow, when we think about what the shadow is, we have the light and the shadow. And really all the shadow is just an area that needs some light shined on it. And that is what Jennifer is going to shine some light on some areas of dentistry that are really important to not only hygienists, but dental assistants, front office, basically the entire team, dentists included. So it's just going to be this open, flowing conversation between Jennifer and I. And the other reason why I wanted to do this interview is because May is Mental Health Awareness Month. So I see in different social media dental hygiene posts, you know, that, oh, I have this going on. I'm stressed out over here. I have this anxiety happening. I'm burned out. I want to quit. What do I do? Some of us are all over the place as hygienists. And again, I'm going to speak from a hygienist perspective, but this video really is for anyone in the dental profession. So I want to open it up to Jennifer and let her take this, you know, get the ball rolling in the shadow side of dentistry of this talk that we're going to be doing today. So Jennifer, thank you so much for your time. And thank you for helping me get the word out and share with other hygienists that they are not alone in what they're feeling. So take it away. Start with your story. Start with what you do.
Well, I'm Jennifer Stanley. I've been in dentistry since 1999. So I started off working oral surgery, and then I went back to school and became a hygienist. When I graduated in 2006, the market was very flooded. And there was no full-time jobs, and that's what I was, you know, of course, looking for. So I automatically just figured it out as I went, and I temped for about 2.5 years, and then throughout my career, I've taken a few full-time positions, and then I would continuously be pulled back to temping, or, you know, what I like to call being a guest hygienist, because that's just who I've realized I am. Is that I need change. And when you're either afraid of it, but then once you embrace it, it's fun. So I did not start going to conferences until like 2016, which I just kicked myself for not doing it before, because I've grown so much more and realized that a lot of the positions that I had were, you know, a lot of it was my fault because of the mindset that I had, and I needed to work on myself, and I needed to be with other people that were like-minded. So I did start a Facebook group called Gadget Girl RDH. That was in November of 2020. And I've always kind of been that person that I want to introduce other people, and to these people. And I'm like, I knew a lot of people from the conferences, and if you're not there, then you don't know what's out there. You don't know a lot of the products. You don't know the little gadgets. You don't know, some of the newer things if you're only doing the CE that you do it, just to get your license renewal. So I was actually on a long-term leave, and I was out of town. So I just was like, I've been wanting to do this. I'm just going to do it. So November 2020, I started that Facebook group. Tried to make it to be a positive group because there's so many negative ones. But I also realized that part of the problem that we have with this whole issue with dentistry is the fact that there is too much toxic positivity. And it took me a while to wrap my head around that because, and I've kind of grown up the way that other people have, okay, just suck it up, put on a smiley face. And, just like when you're working, have you seen, you're talking about, mental health, right?
Yep.
Yes, there's those commercials about the depression medication, and then they've got the sign with a smiley face on it that they're putting in front of their face, right? How many of us feel like we're doing that with every patient? We're doing that with our coworkers. We're even doing that with our family and friends.
Yes.
We are saying, oh, how you doing? I'm fine. No, you're not. But you're hiding it. But then you also don't want to do the whole toxic positivity thing where you just suppress all your feelings, all of your emotions, and just say, okay, no, it's willpower, just smile and it's going to be okay. I began, trying to transition out of traditional clinical hygiene. And so I have done a few things, I've done some podcasts like with Carrie Ibbotson and Michelle Strange with, oh gosh, it is escaping me.
I don't know who that is, so I would help you.
Two Hygienists. A Tale of Two Hygienists podcast. A Tale of Two Hygienists podcast.
Okay.
Michelle Strange. And so anyway, was with them. And then I did a podcast with Amanda Hill, who had your dental top 5, and we talked about temping. Also last year I did a continuing education course, which was Young Dental's first 2-parter series, and that was on temping. So having the COVID, this shutdown, it was a forced reset for all of us. So it very much was for me too. That's when I was like, okay, I'm going to start this group. Okay, I'm going to change the way I am doing my business as far as, where I'm temping, how much I'm asking for, what are my red flags and what am I going to ignore? What am I not going to ignore? And what am I going to stand up for? And what am I going to just say, okay, I appreciate the opportunity, but no. So I've been in all these groups, and you realize you're so not alone. Everybody is hurting out there, whether it is depression, anxiety, whether it is pain from our jobs, from, the musculoskeletal issues, whether it is your family and having drama and losing people. I mean, I lost both of my in-laws within a month of each other this last year.
I'm sorry.
In the middle of moving from a house that I had lived in for 21 years.
Wow.
And, so all this forced change really messed with my psyche. And I had to take a little bit of a break because the anxiety got to be a little too much, and just as far as, disclosing this we all have issues, and it's sad that we feel like we have to hide them. Like, I have to not talk about the fact that I really could hardly get out of bed that day to make it to work, because I felt that bad. And like with an office that I used to work at, it was really hard for me to get to work early and on time, because of the medication I took at night really made you very drowsy the next morning. So it was really hard. And I've never been a morning person, but I sure am not a morning person with that type of medication. So there's a lot of people that, have a lot of mental issues. And whenever all of this happened with COVID, I think a lot of it reared its ugly head, the stuff that we've pushed down and ignored. All of a sudden, we were left there with our thoughts. We were stuck in our house, and we had to reevaluate what was important to us and where we were in our life and in our career, and if we were happy.
Yes, exactly.
And, a lot of us realized we were not. A lot of us realized we were not, that we were taken for granted. A lot of us realized that what we had built for our life was not what we really wanted. I always thought I just didn't find the right office. It's just, I can't find the right office. Well, let me tell you, I ended up working in an office, and it was wonderful. The people were great. I mean, there were some issues. Hey, they need to update some equipment, that kind of thing. The doctor was a very empathetic person. I mean, it was wonderful. And I was going to start working there part-time after all these years of doing temping. And I had to really take stock. And I mean, I started crying. I'm like, oh my God, I have found a great office, but I'm still not happy. So then I'm like, it's not what I always thought would be around the corner that would make me happy, didn't. And that's when I had to say, okay, I am going to start I'm decreasing my hours. I'm not going to do all those long-term leaves. I'm going to add in other things like speaking. So basically the COVID thing and the whole shutdown kind of made me get up off my butt and start doing something, and realizing, going through the motions is not the way to do this.
Yeah.
It's now or never.
Right.
And so I don't want people to all just leave the dental field because of all of this. But you have to create boundaries. But in order to create those boundaries, you have to know yourself and take responsibility for your own mindset, and see if you actually are contributing to your own toxicity.
Yes.
Because I was, and I didn't realize it until I started, being around different people. I started taking personality tests, emotional intelligence tests, doing these things, finding a coach. It really is just a matter of getting to know yourself, and then what serves you and what does not. If being around certain family members makes you feel bad about yourself, then you need to distance yourself from them so that you can heal. And if working in this one office and you're treated kind of like on the movie Mean Girls, and you're not treated well, and you're not allowed to sit at the table, then maybe you don't need to be working there anymore, or you need to at least reduce your hours, or you need to actually, speak up and just be prepared though for the ramifications of it.
Right.
But regardless, you have to do what is right for you, what brings you joy, and get rid of the parts that do not.
Yeah. So I want to go on what you're talking about with the boundaries and how you looking at how your boundaries are with your friends and family is a good example of looking into your professional life and how you're holding boundaries in your professional life. And so I invite anyone watching this video to do something like that. You know, boundaries, I have had communication with different team members and have said to them, you need to speak up on that. If this is something that's bothering you, then you need to speak up on that. And the response I most commonly get is, I don't like confrontation. And I want to share that there is a difference between being confrontational and holding a boundary. And you know, you do not have to be confrontational in order to hold your own boundary. You just have to be firm in your own understanding of what that boundary is. It doesn't mean that you have to, you know, bite someone's head off because you're trying to hold your own boundary, right? You can lovingly hold your boundary. If you have children, you're lovingly holding your boundaries all day long, every day. And so we can do that with everyone in our life, including our team members, including our employer, which is a big one where I see boundaries being crossed, like severely being crossed. And understanding that you can say, I don't agree with that, lovingly. You can say that in a nice way. I don't agree with that. You can vocalize by saying, this is my boundary. You don't have to act out what your boundary is. You can just simply say, this is a boundary for me. You know, I've never actually heard someone say that in a dental office. I say it. I have no problem saying it, but I've been coaching women around boundaries for 10 years now. So I think it's very important that we understand there's a difference between confrontation and boundaries. And some people, what we were talking about previously, Jennifer, is the whole, we kind of suck it up, that toxic positivity, brush it under the rug. Because why? Why do we do that? Is there a fear of speaking our own truth? Is it a fear of not knowing how to properly hold a boundary? Is it a fear of judgment? What do you think that is, that people feel like they just have to have that toxic positivity and say, ugh, never mind, I'm gonna, because when we're soaking, when we hold our own in, our own truth in, we're doing it with this idea that we're helping the other people around us, but we're just making ourselves sick. And that is what we're seeing, is we're seeing these hygienists and other dental professionals like physically sick in their body because they're not feeling heard, they're not feeling seen. So can you talk a little bit more about that?
I feel like a lot of it comes from how we've been conditioned growing up.
Yes.
And I mean, it stems back to hygiene school. I mean, hygiene school for me was, I'm sorry, but I'd be like, whoo, no, never. It was terrible. I mean, I did good. I made good grades. But it was a bad time for me personally because my father was in hospice care at home. And I lost my father during our first semester of clinicals. So I had to like push it all down and keep it moving because we're in hygiene school and you just got to suck it up. And hygiene school, you know, they taught you, and there's nothing against the instructors, but you were taught to be subservient. Am I wrong?
No. And you are so right. Yes. Yes.
And so, you know, and whatever we did, we had to have it checked behind us. We didn't have a real voice, but it was rigorous. I mean, it had to be, to get all of that in. But I believe we were sort of done a disservice by not approaching the subjects that we were going to get into once we were in the field, and boundaries.
Yes.
And how to have a professional conversation without it getting ugly.
Right.
And we have, there's going to be people that you're never going to make happy, and you're never going to get them to listen to you. I mean, you got the whole narcissistic personality going on. These people are never going to admit that they're wrong. They're just all the mental stuff, people isolate you. And if you were isolated when you were a child, like, it all comes back to personal stuff. And do you know if you're an introvert, if you're an extrovert? Because I feel like a lot of dental healthcare, we're very empathetic people.
Yes, I just said that word in my head. That is it.
Yeah.
Yes.
And some of us are empathetic, and some of us are actual empaths, which does get a little woo. Some people might, roll their eyes at it, but it's draining. It's draining, to become and to absorb what you become, what your patient needs, you become what your coworker needs, you become what your spouse needs, you become what your family needs, and then you don't have a whole lot left in yourself. And a lot of people, like I said, in the healthcare field, are just either they're empaths or they're highly sensitive, and they don't know how to. I'm still trying to learn how to deal with it. So it's hard to pinpoint, because it's almost, your personality itself. And a lot of us who are more, we have to be extroverted for our job, but maybe in reality we're an introvert.
Yes.
And it really takes a lot out of us. And I see a lot on the forums, all these different Facebook stuff. So, a lot of people are like, just making small talk with our patients is exhausting. And a lot of the people that, have a real hard time with that is because they're introverted personalities. And they don't know how to make themselves into what somebody else's need.
Right.
It's hard to do. So you talk to me a little bit about the whole, you're a lot more on that, with life coaching and the light, the dark, the energy, protecting your energy.
Yeah, and I actually have written a few articles that are on my website, theawakenedhygienist.com, that are, if you are an empathic hygienist or figuring out if you are, there's an article on there about basically protecting your energy. And there was a period of time where now it's become just completely normal, but I had to create the practice itself. I had to start saying, when I was with a patient, every new patient that came into my room, I would have to, in my mind, say, this is my energy, this is their energy, because feeling other people's energy, we invade other people's space. So we're right in there, right? And I don't want to get too woo-woo either, but I am, and so I will in this moment. If you understand, not just you, but just you, meaning people in general, if we understand that we're all energy, and our television is putting off energy, right? We are putting off energy, and we're taking our energy and we're blending it with our patients. every single time we're with the patient. That energy is being enmeshed. And so there are times, if you are an empathic hygienist, you are feeling what the patient has come in with, whatever their energy baggage is. You're absorbing it, but you don't necessarily know, oh, they must be having a problem with their husband, or, it's not like that. It's just, you feel kind of on guard, and then maybe that patient is in a cranky mood, and then you start kind of feeling cranky and taking that on. If you just understand, like, this is my energy, this is their energy, just simply saying it in your mind is enough to create that separation in energy. And not only that, we're working in the mouth. The mouth is where we speak our truth. We as hygienists, we as women, we as humans, and we're working in that with other people who are speaking their truth or suppressing their truth. So there's a whole energy exchange that is not even discussed when we're working with patients. But it is something that is important. And you had mentioned, taking personality tests, finding out about yourself. This is definitely an important step, because we have to know who we are. And you had mentioned, and it could have been in a previous conversation, Jennifer, about, we identify, and I think as women, we take this on a lot, is we identify as a hygienist. So for example, you go into a circle of new people and they're like, oh, what do you do? What do you do? What do you do? What do you do? Right? So everyone's like, oh, I'm a hygienist. It isn't, tell me about yourself. What makes you happy? What lights you up? It's, what do you do for a living? Which is really just indirectly saying, how do you pay your bills? What job do you do to pay your bills? So we're not really getting to know each other, And
I think we've lost our personality by getting just stuck in what our job title is.
Yes. Yeah.
But I have to, we don't get a whole lot of time to even go to the bathroom, to get some water. We don't have a whole lot of time to do anything. So I find that on the way, because I'm always commuting, I live in the country, so I'm always commuting at least 30 minutes or more. So, you find podcasts, you make a playlist. I have my Amazon playlist. I have it on my phone that says, "You got this" is the name of my playlist, or it's going to be a happy day, so I would listen to that music, and not trying to be antisocial, but a lot of times at least 20 minutes of if I can carve out that much time, at least 20 minutes of my lunch break, I need to go to my car.
Yes, I do. Yes, strongly agree with that.
I need to sit there. I go as far as to just lay back, recline, throw my feet up on the steering wheel, whatever. If I'm playing with my phone, or if I'm just listening to music, or if I am just sitting there breathing,
right,
just to calm myself and to really amp myself back up to go finish the other half of my day. And then on the way home, maybe you're listening to music, maybe you're listening to a podcast, maybe you're pulling out your heavy metal because you done had the PETA patients from where, and you just need to have some headbanging music. It's just, you have to find out what works for you.
Right.
You have to take care of yourself, because nobody else is going to take care of you. And you can't take proper care of your loved ones if you're not really present and taking care of yourself.
That's right. So you had mentioned about temping, and that was a way that you felt you were able to find that space to, instead of going to that same office day after day, you were able to help yourself by thinking, what is a different way I can use this profession to my advantage? And temping is one that you do. So you're not in a regular office. You only temp. So say a little bit about that.
Well, most of my career has been spent doing long-term leaves. So like, you know, when maternity leaves, I mean, you know, we all have, okay, somebody's getting rotator cuff surgery. They're going to be out 6 to 12 weeks, having a baby. I mean, and I've had a lot of repeat business, a lot of going back to the same places. So I've made most of my career doing that, and then just doing a little sporadic stuff here and there. And in between, I did take a few full-time jobs, and it was just not for me because there was bullying, gaslighting. I had a really bad experience, and it really messed me up mentally. It really messed with my psyche. And I returned to temping, and it was like a breath of fresh air, not because I'm not a person, you know, don't like people, but I didn't have to deal with office drama, office politics. I didn't have to be the one doing the recall system. I just went in. I did what I was trained to do. If I could help, and I do this a lot with the offices I go into, I will ask if it's okay to bring my own instruments, and I'll bring some of my own instruments. And whenever that doctor sees that I'm using my own instruments, and they might say, well, you know, they've been asking for some new instruments that they're dull. If she's using her own instruments, you know, that kind of thing. So I found that I was helping people by doing that. So I was still making a difference. And a lot of the patients that maybe, the hygienist was doing it right. They were telling them every single time about, you know, the pH of their mouth, and they were talking about the periodontal disease, and the patient wouldn't, you know, complete the recommended treatment. Sometimes it just took listening and hearing it from another person for them to accept it. So, but for me, now the thought of working full time in one place, it kind of makes me like have commitment issues.
Right.
You know, I don't want to have to keep up with all the behind the scenes stuff. And so it is nice to go in, but it's not easy because you know, you're cooking, but you're cooking in somebody else's kitchen, so you know, it's stressful.
Right.
It's stressful, but for me, that's been my balance. And I've had to, like with my family, they couldn't understand it, and they couldn't get it, that's what I wanted to do. That's what I like doing, because I come from a family of nurses, and they all worked in a hospital setting, and they never did anything other than move to a different floor. And when they did move to a different floor, get pulled to a different floor, they were a basket case. So they couldn't understand why I would want to do this.
Right.
You know? So part of my evolution or whatever is by, you know, becoming my own person. And I've never pretended to be normal. It's just a cycle on the washing machine, you know. And so you have to stay true to yourself and not make yourself fit into a box that you're not meant to be in.
On that note, what I wanted to share is that, you know, we go through we take all the prereqs, then we go through dental hygiene school. We're in this mindset of go, study, you know, for so many years that when we're done and we're working, we're like, oh my gosh, I have all this free time. What do I do with myself? Right. But we've put ourselves in that mindset. And for me, I graduated hygiene school in 2002. And by 2005, 6, I was already feeling the burnout. And instead of just sitting in that, I decided I want to learn all the time. So I went back to school. I started doing things. They were simple little things, but I went back to school. But and I got a lot of certifications. Where I'm going with this is there are hygienists out there who are feeling that they're stuck in this box. They don't know how to grow out of that. And that in itself can be the shadow, because we think we've accomplished our profession. I wanted to be a hygienist. I accomplished it. And then now
we weren't really told a lot of options other than clinical, traditional hygiene.
Exactly. And so we're in that mental thought of like, maybe I made the wrong decision. Instead of understanding how you can get dentistry and dental hygiene to work for you. So I right away saw dental hygiene as a means to pay my bills and also to pay for other schooling that I went through, certifications, things that I love and enjoy and wanted to do. And I was using hygiene pay in order to do that. And I think that's really important just to mention, because I think some of us get stuck in this, well, but this is what I accomplished, but I'm not happy here, but I accomplished it. But it's like, okay, you can grow from that.
Glass ceiling.
Yes.
We're putting a glass ceiling on ourselves.
Yes.
We're not, it's okay if you only want to, and I'm not, if you only want to do clinical hygiene one day a week and you want to do something completely different the rest of the week, if you want you're getting your side gig to become your main gig.
That's right.
It's okay. It's just, I think we have this feeling like I struggle with, am I a real hygienist if I'm not working full time? Yes, I am. Even though I've drastically reduced my hours within the last month, because I needed, to focus on other parts, with doing like speaking and, becoming a CPR, BLS instructor, a lot of different things that I can do. And even maybe something that has absolutely nothing to do with dentistry, even though I'm a total dental nerd, I don't know that I'll ever get out of that box.
Right.
But we have to kind of forgive ourselves and tell ourselves that it's okay if we want to do something a little different. If we want to not work 4 days a week, if we want to work 4 days a week, but work 2 of them at one office and 2 of them at another office, so that we have some variety. The only person that can answer that question is you. Yep. The only person who can truly make you happy is yourself. And I've had to come to terms with that, because I'm like, oh, I should be happy, but I've got to work on myself. And I've got to get to know what do I actually like? What actually makes me happy? Right. Because it's, just scraping teeth ain't making me happy. Exactly. But like if you brought in like GBT and like the lasers and all that stuff, I'd be reinvigorated. So, you just have to find out what works for you, but you do have to do the boundaries. And even though maybe you've been at the same place for 17 years, you might have to come to the hard truth that maybe it's not right for you. Right. And now is actually the time where the opportunities are endless. Like I said, the market was flooded when I first graduated. Now it's not, but I feel bad. I feel bad for the hygienists that have just graduated. I do too, actually. Because they're being thrust into this full force, head first, into the deep end, into a lot of offices that are playing catch up and haven't been able to find a hygienist. And then they're going to actually be not giving them an hour. They're going to move them down to 45 minutes. And, it's just, they're going to burn out within 2 years. Yeah. I mean, I'll admit I burned out several years ago and just kept doing it, but I feel bad that they're going to burn out even quicker, and their bodies are going to, your whole health. and it does start with mental, though. Your mental health and what's happening in your life affects you physically.
Mm-hmm.
You know, it's not all in your head. You know, there are disorders and issues and stuff like that, but a lot of times it can manifest. Your mental issues, your emotional unrest can manifest and, you know, contribute to all this musculoskeletal tightness, and you know, it makes it worse.
Yeah, you're exactly right, because everything starts with a thought. Everything starts
and I'm
with
an
a thought.
overthinker.
Yeah,
Overthinker, people pleaser, type A personality, and a lot of us are like that.
mm-hmm.
So we one of the ladies that she's doing speaking now, Carrie Corrales, I think. Anyway, she had posted a meme in her group, and it was a picture of a clown. And it's like they're putting on a little makeup and then a little bit more and a little bit more and then putting on the thing. And they're like, if I keep doing this, they'll notice me. If I keep doing this, they'll notice me. If I keep doing this, they'll notice me. And it's a mental issue, emotionally, us being ignored, our voice not being heard. It wears on us personally,
Mm-hmm.
mentally and emotionally and physically.
Mm-hmm.
And we have to do those boundaries. And the hardest thing, the first boundary, the first thing you have to learn is to say no.
Right. And to understand that no is a complete sentence.
Yes.
No.
Yes.
Because I think we want to follow it up with, because of whatever reason.
I mean, how many times have we asked for a vacation and we felt the need to explain where we were going and, you know, to over explain? I mean, I do that. I over explain. Like, they don't need to know. All they need to know is you're sick. They don't need to know that, you know, this, and this. And they don't need to know that, oh, you're going on vacation and you're going here, there. Yes. You know, they just need to know that you are going to use your PTO time and you don't really owe them an explanation.
Right.
And that itself is a boundary.
That's right. And it starts with understanding that we teach people how to treat us.
Absolutely.
And so if you give in or you let that boundary be crossed, it's that envelope will constantly be pushed. Go ahead.
We've gotten really good at martyring ourselves.
Yes.
It's gotten comfortable for us to be the victim. Mm-hmm. When we really are, yes, we are victimized. Definitely, we have some issues, but a lot of it is what we've allowed, and we have to admit our part in it.
Right.
Yeah, well, maybe the doctor wouldn't get your new instruments and you're still using the same instruments. Well, you're still using the same instruments. Mm-hmm. So you need to, you know, figure out how to, you know, make that boundary and be like, I absolutely have to have this.
Right.
You know, and, you know, it starts there. So I think a lot of us have just become complainers.
Yeah.
And
well, you know,
instead of solutions, you
yes.
know.
It really is understanding, because so many people in the world play it small. They keep themselves small. They don't grow into you know, who they are here to be, their purpose, you know, we all are here for a reason in this world, right? But in the dental office, a lot of hygienists are playing small. And if you think about it, what if all hygienists said, I'm going on strike? Dentists they don't want to do what we do. They want to do what they do. So we need to remember who we are and the part that we play and the role that we play in the office. We have a big role. And if an office were not to have a hygienist at all, that's going to minimize what the dentist can do on their schedule. So us hygienists, you know, to come full circle here, and, you know, really kind of wrapping this up and in closing, you know, Jennifer and I wanted to have solutions for you. If you're a hygienist listening, if you are a dental assistant listening, or even front office, understand that, one, we've mentioned it, I don't know how many times we've said the word boundaries in this, you know, time, but boundaries are huge. Understand that it is up to you to teach people how you want to be treated. And if you don't teach them, then they're going to continue treating you the way that they want to treat you, you know, and that's huge. Personal growth, personal responsibility, understanding that you are who you are. Allow yourself to grow. Don't be defined by the RDH after your name or the RDA after your name. You are first and foremost this human being who has needs, and you also need to work in an environment that can support that. And the environment and office culture that I need and that Jennifer needs is different than what you need. And we need to align ourselves with the right office culture. Don't just go and interview for a job that asks you questions like, how many hours do you want to work? What are the days you can be here? And how much hourly wage are you anticipating? That is not an interview. You know, that might get you in the door or may, you know, but you have to have the right questions so that you're working in an office that supports you and your needs.
You have to go into there with the mindset that you are interviewing them just as much as they're interviewing you.
This is it. And
if
we're
you
in a
clash
position.
Personalities, if you automatically clash personalities with somebody, red flag.
Yes.
Even the meanest person can be really nice for one day.
That's right.
For that one little working interview.
Right.
So you have to go into it with, it's all about mindset. It all boils down to mindset, how you feel about yourself, how you react professionally, how you are personally. You just have to figure out what you want, what your boundaries are, and not allow people to push in on you. And you, once you figure out what you want to do, you know.
That's right. Yes. Yeah. You know, it just, when you said that, what came to mind is, you know, when you're in a relationship, we date and date and date, and then we find someone, or maybe not at all, but let's just, for the sake of this example, say we find our one. Okay. But we had to date a lot of people in order to get to that one. We're not married to all of them. We're dating them. So I like to think of, you know, when you're looking for the office that's a right fit for you, look at it as though you're dating this office. This might not be your forever office. This is not your forever one. You're dating them.
And you may outgrow it.
And you can definitely outgrow it. Absolutely.
And it's okay. Don't feel guilty.
That's right.
If you do.
Yes.
You have to honor yourself.
Right. And don't play small. Do not play small. Understand your role in the dental office. Every office needs you. And so understand your role that you have in there, and don't play small. Be who you are and be empowered and standing tall and firm in who you are, what you bring to the practice, what you bring to the table, and what needs you have that need to be met in order to be there. So,
and we've gotten, a lot of times we get lost in the our role, our what our career is, and we lose ourselves. Just like sometimes, with marriages, you start to lose yourself in it. So you have to get to know yourself. I mean, seriously, I learned a lot about myself taking personality tests.
Yeah.
Dental posts, shout out to Tanya Lanthier, who has dentalpost.net. They have free like emotional intelligence questionnaires, and there's DISC. There's all these different things that you can do to figure out who you are and what you want and what you can improve in yourself.
Yes.
But most of all, you have to honor yourself.
That's really what it comes down to.
Be open to change.
Yeah.
Because it's inevitable.
Mm-hmm. That's exactly right. All right. Well, with that, I want to give you a big thank you, Jennifer, for saying yes to allowing me to have some conversation with you around this very important topic, and really shining the light on what hygienists, again, and it's also dental assistants and front office, just aligning ourselves with if we're aligned between our mind and heart, then we're going to be able to find an office that is aligned with what we are seeking. So thank you for sharing this time with me, and thank you all for listening. And you can find Jennifer, give them your information, because you're on Gadget Girl.
Yeah. So I do moderate the group Gadget Girl RDH. But you can look me up. I have a landing page. It's StanleyDentalSolutions.com.
Perfect.
So my information is there, my email, my phone number, heck, my resume, everything's there.
Okay. So. Wonderful. All right. Well, thank you everyone for listening, and thank you, Jennifer, for sharing everything that you did.
Thanks, Sarah.
All right. Thank you. All right. Take care.